to that. Thank you. Is that a yes from everyone that we're able to share this, to record this?
Yep, that's a yes from me.
Thank you.
Yes.
That's a yes for me as well.
Thank you. Okay. Okay, so again, welcome everyone. Looking forward to this afternoon's conversation. One of the things I'd like to do first is welcome, I'm hoping Terry, I'm not sure if any of the CBO partners are on with us at the moment, but I'd like to welcome Ibero, Lifespan, Community Health Workers Network Association, Person-Centered Housing Options, Center for Catholic Charities Center, I'm sorry, and Refugees Helping Refugees, as well as Community Place and the Charles Settlement House, who are the 7 agencies that are currently contracting with the county to do this vaccine work. So welcome to all of you and welcome to everyone else who is joining us this afternoon. Okay. Dr. Clark, are you there?
I'm here. Am I?
So I need to step. And so now I'd like to have Dr. Clark talk about, hold on. Where am I?
I think you had a different agenda up.
Did I? Hold on.
I think so, because you had me down for 10 minutes and I need at least 40. I'm just kidding.
Oh, Dr. Clark. No, we're not giving you 40 minutes. No.
I tried to trim my slides.
First, Terry, hold on. We're not giving you 40 minutes, Dr. Clark. We can't give you 40 minutes. All right, so here we go. Terry, are you there? So we're gonna have Terry come on and talk a little bit about community partnerships, and she can talk about the agencies that I just mentioned. Terry, are you there? I thought I saw her there.
I thought I saw her earlier.
Yes, I'm here. Sorry, I was double muted. Yeah, sorry, I actually wasn't really prepared. Sorry, I did not realize I was on the agenda, but thank you for listing off all of the community partners. I did see that we do have several that have joined here today. So the county has sort of an initial pool of partners. We've reached out to over a dozen agencies and ended up with 8 that were willing to kind of just get started in somewhat of a pilot phase of the navigation work to support vaccine education and outreach and sort of facilitated appointment registration and attendance. And so I'm really grateful to the partners that stepped up. I mean, I know that a lot of agencies and probably many, if not all of you that are on this call today had already really been doing some of this work for many months. I mean, that's one of the things that I personally have found really inspiring about COVID, as difficult as this whole experience has been. It's been, you know, really great to see everybody step up to support our community and, you know, just try to help everybody in any way that they can. But, you know, the county wanted to try to formalize that and also provide some resources, you know, initially funding to some agencies to, you know, to try to compensate for that effort, because it takes time and it takes energy. And, you know, when we first got started in early April, we were launching a bunch of new neighborhood-based community clinics to try to bring vaccine closer to people, which a first good and really important step in our equity efforts. And so the CBOs that the county engaged with definitely prioritized making sure that people knew about those clinics and were able to get registered into them, because at that time, you know, we were still in an environment where people were struggling to get access to an appointment at a place at a time that was convenient for them, that they were comfortable with. And so that was sort of the priority or the focus of the contracted CBOs during the first part of this pilot phase. Now that we're in May, all of those neighborhood clinics are entering into their second dose period. And so during the month of May, we will, there are still first dose clinics available. They're just a bit more scattered. There are some in rural areas, some in suburban areas. There is still the convention center, but we're also now experiencing collectively as a community and across the nation, I think, that we've really kind of hit, I think, the majority of people that were pretty ready to get vaccinated. And so that's not to say that the people that remain are unwilling to get vaccinated, but maybe they need more help or have more questions, or we need to do something differently, with and for them. And so I think the shift and the pivot that we need to do in this next phase of the pilot is really around education and outreach, and how do we help the folks that are still on the fence make the decision to get the vaccine if that's what's best for them and their family, which, that's of course the decision that we hope that they make, but it's a really personal choice. So I think the timing of this forum is really great because the Hub and Common Ground Health have been doing a lot of work, a lot of local research, as well as national scanning to try to come up with, a pretty broad and versatile set of tools that CBOs that are contracting with the county, but also, the rest of you that, like I said, have really been engaging in this work anyway, can use to try to help us, reduce hesitancy and increase vaccine uptake, because this is a pretty critical time, I think, for our community, so that we can kind of reach that tipping point. So I don't know if that helps, Jackie, or if there's anything else that you wanted me to touch on.
Nope, that was great. Thank you. Thank you very much.
Sure thing.
And Dr. Clark, we will now have you. You have your 10 minutes.
Seriously, I have like a 20-minute presentation.
You are not getting 20 minutes.
I just gave you 5 of mine, Linda.
The last agenda said 20 minutes. So, okay. Here we go. Okay.
Do I need to stop sharing? No, you're good. Okay.
I stole it. Okay. So my job today was supposed to be to give a sample presentation. So I'm going to really fly through these. This is really, seriously, it wasn't meant to be 10 minutes. What I'll do, I'm going to go really quickly, and then if you can save some questions, I think we have time for questions and answers for everybody at the end of the forum. Okay. So really quickly, what is a coronavirus? Coronavirus is a virus, and it has a crown. Now these spikes look like a crown, and they're round, and that's the word corona, means crown. And they're very critical, those spikes, to how we learn to fight the disease. How do we get the name COVID-19? It comes from coronavirus disease 2019. So it's not the 19th version of the disease. It's from the year 2019 when it was discovered. And so coronavirus is the virus, and COVID-19 is the disease that is caused by the virus. Has lots of different symptoms that can occur, but they look like a lot of them look like other respiratory conditions that we have. So you could have fever, dry cough, aches and pains, headache, trouble smelling or tasting, pink eye. That trouble smelling or tasting is something that really, causes some pause, even though we do see it with other problems with the sinuses and the nose. That one's really kind of characteristic of COVID-19. But then, the other things are fairly generic and hard to differentiate from other diseases. So how do you stop spreading from COVID-19? We'll talk about that in a second, but it's very important to know that you can still spread COVID-19 even when you have no symptoms at all. So you really need to take some precautions that we all know about now: wearing the mask, wearing it properly, staying apart, washing your hands often and thoroughly, stay home when you're sick. So I'm going to talk a little bit about how quickly we were able to produce these vaccines. And I think that the main point is this was not done. People are like, oh, this is way too fast. it was done in the proper sequences that we do all vaccines, but we had some head starts. So we know about coronaviruses from other viruses that we've had, like SARS and MERS. We're talking almost 20 years ago. So we've been studying these types of viruses and thinking about how we can fight them for decades almost. And scientists, I think this is a little out of order. I'll come back to that. They went through all the phases of any trials, just like we do for any vaccine, whether it be hepatitis B or mumps, any of those vaccines. So they started phase 1, which is a very small group of volunteers answering the questions about, is this safe? And these are healthy volunteers. Then you go to several hundred volunteers to try to figure out if there's some side effects. How's the body responding to this? Then we have thousands and thousands of people that participate in phase 3 trials. And they talk more about, how does the disease rate differ in the people who got the vaccine versus the people who did not? Would look more at side effects and safety, and then the vaccine can be approved. So we're now have at least 3 vaccines in our country. There are others throughout the world that have been approved and are in phase 4, which is longer term studies. So I had a prior slide saying that, they're looking at other things. People are like, I don't want to get a shot. They're looking at nasal sprays and pills and other forms of immunization, but they have not developed those yet, and they are not available. So the vaccines that we have meet all the safety standards that any other vaccine that we give has to meet. The reason we were able to do it so quickly is because this is such an infectious virus. It spreads very quickly, so you can find out very quickly whether your vaccine works. So that was helpful. So in our country, we have 3 vaccines that are approved under emergency authorization use, and that's the Pfizer, which we hear about for people 16 and up, Moderna for 18 and up, and Johnson & Johnson, or the Janssen vaccine, which is also 18 and up in terms of age. You may have heard that Pfizer is probably going to be authorized very soon for kids as young as 12, which is exciting. I do want to talk a little bit about this pause. These are some new slides to the deck for people who have looked at this deck before. So we all heard about, when everybody went on pause for a couple weeks around the Johnson & Johnson vaccine. Originally, the report was 6, I believe, women ages 8 to 48 who had a rare type of blood clot, a cerebral sinus thrombosis, which is a blood clot in the brain, and this was out of almost 7 million people vaccinated with Johnson & Johnson. But because the surveillance was so good, those safety systems were so good, they were able to pick out those 6 people, and with further examination, they found 15 that had this rare type of blood clot. So they said, oh, let us put a pause on it. And it was important to put a brief pause. First of all, shows our safety systems are working, but it also gave you a chance to instruct the doctor. So, because usually when we think clot, we got to give heparin or something to thin out that clot. In this case, heparin it was bad for people with this type of clot and caused very bad bleeding. And so we were able to advise doctors, you cannot use heparin, you have to use something else to treat this type of clot, and be able to understand what the possible symptoms that exist with this rare complication, so that we can be prepared to handle that. So I think I said that already. Just really comparing your risk in terms of blood clots. There are different types of clots, but those cerebral, those brain blood clots that I mentioned that are so rare, there's 39 to 1 million chance of getting this type of clot. So out of 39 million people, 1 person will get this type of clot. So you can see that's very, very rare. However, clotting disorders are quite common with COVID. So not quite common, but 2 out of every million people and this is, I'm sorry, this is for that same weird type of clot. It's still a very rare event with the Johnson & Johnson vaccine. And you may have heard, you've seen that with the AstraZeneca vaccine in Europe as well, but still very, very rare. So 2 people out of every 1 million, two people out of a million will get this clot after the vaccine. And I will clarify that later if you need that. I'm sorry. Jackie's making me rush. So with the Pfizer and the Moderna, you need two different doses. Pfizer is a little closer together, your first dose, and then 21 days later, your second dose. And the Moderna is 28 days apart. So it takes about 2 weeks after your second vaccine to consider yourself fully immunized. With the Johnson & Johnson, same 2 weeks after that one dose to consider yourself fully vaccinated. At this point, we don't recommend you get one Pfizer, then a Moderna. Really stick with the same brand because that's how the research was conducted, using the same brand. But they're looking at, if you're in an emergency situation and you need your second dose, can you get a different brand? So which vaccine should you get? All of them have approved, all of them are safe, and all of them are great at preventing severe consequences and death from COVID. So the best one really is the one you can get. I'm going to really fly through this. So people who shouldn't get a COVID vaccine, if you're currently in isolation or quarantine, active COVID-19, had antibody therapy or blood from somebody who was positive or had been already had COVID. All of these people should not get the vaccine. You can get the vaccine after you recovered from COVID-19. If you're allergic to PEG, polyethylene glycol, which is the stuff that's in the constipation medicine, Miralax, you should not get that if that's a component of the vaccine. Polysorbate and other vaccine components for preservatives, if you're allergic to those, you cannot. So right now, people under 16, and like I said, pretty soon it'll be 12 years old. So it really is your choice, and it's perfectly normal to have questions and concerns. But we really feel that there are great reasons to get vaccinated. It keeps you, your family, the community safe. You won't have to wear masks anymore, and I'll talk a little bit about that. Eventually, when we get enough of us vaccinated, you can gather socially for weddings, parties, funerals, all those things that we've missed. We don't know how long immunity will last with the vaccine, but it is definitely more protective and a safer way to get protected than getting the virus. So the COVID, some people say, well, I'll just, get COVID. I'll, feel like I have a cold and I'll get better. That's not necessarily true. First of all, you don't know how long the immunity will last from getting COVID, and we don't know how the side effects or how dangerous the COVID will be for you. The vaccine will save lives. We've had well over 500,000 people die from COVID. And we don't know who will be a long hauler. Some people have long-term health effects. The vaccines will help save jobs. We'll get to open our businesses up and get the economy working. And I know personally, when I got vaccinated, I did feel some relief. I felt not only that I was being protected, but I was able to protect my family and my patients. And once enough people get the vaccine, it will allow all of us to live life at the fullest. I've talked a little bit already about how safe they are. We've had careful review of the data. We've talked about the safety systems that are in place. And I understand there's up to 8 different safety systems that are in place to be able to detect any problems with the vaccine, like this rare blood clot we saw. It's safe for people with medical conditions. You understand that, you know, it is normal to have some side effects related to the um, to getting vaccinated, because that's your immune system working, doing its job. And just like when other times you get sick, your immune system kicks in and you get some of those symptoms like body aches and fever, because that's how your body is fighting the virus. So pain at the injection site is the most common. And some people can get quite a bit of swelling there. Fatigue, fever, headache, body aches, chills. The great thing is that most people get those within a couple days of getting that last dose, or the first dose if it's Johnson & Johnson. But it's over in a day or two. You know, I was really fortunate. I felt like I only had really horrible symptoms for a few hours, and they weren't that horrible. I was just tired. I do want to emphasize the vaccines cannot give you COVID. You cannot get COVID from the vaccine. There is no live virus in the vaccine. And I'm not going to go through all the biology right now, but I would love to if anybody asks me. The vaccines are free. Some providers may charge a, uh-oh. Are you guys seeing something in front of the slides? Okay. If you don't have insurance, there's still no cost to you, but some people will try to use insurance to capture some of the costs of giving the vaccine, you know, like paying your staff and storage and whatnot. I know Dr. Lucas is going to talk about data, so I'm not going to give you a lot of data. I do want you to be aware of a great resource to everybody, and that's our hub website, www.FL, which is Finger Lakes, vaccinehub.org. And it's a great website to find places to get immunized, but also to get information about the vaccine. Talk a little bit about this. Kids soon may be eligible, and talking this week or next week. We're looking to see Pfizer be approved to give to kids as young as 12. Right now, we're just up to as young as 16 is the lowest age, and it's still only for Pfizer. So be aware parents and guardians need to be present for kids under 18 getting vaccinated. So I won't talk about this either because Dr. Lucas is going to talk about that. And in terms of inequity, Black and Latinos are twice as likely to die of COVID-19. Latinos and Indigenous people are more likely to go to the ER, 1.7 times more likely to go to the emergency room due to COVID-19 than white people. So, you know, we do want to emphasize that Blacks and Latinos, you know, people of color play key roles in the development of these vaccines. You know, Dr. Corbett led work on the Moderna vaccine. Locally, Dr. Branch, who's a Black doctor and a scientist, is leading one of the studies on the AstraZeneca vaccine. So since the start, people, you know, doctors and nurses and other providers of color have been working to provide outreach to the community to help spread the, to help slow the spread of COVID-19. Vaccines are endorsed nationally and locally by Black Nursing and Medical Association. You need to be aware when you're counseling people that immigration status is not collected. You'll never have to give information to the government that could be used to identify your immigration status. So, you know, really quickly, a couple of questions that we hear often. Well, you have to get more shots. And, you know, the question about mutation, that's what viruses do. That's what they do. You know, that's what the flu virus does. They change constantly to try to be more efficient at what they do, make us sick. So as with other vaccination, it is likely that we may need some booster or additional shots that preparation may change as the virus changes. Question, am I protected from COVID if I only have one dose? You may have some protection, but you do not have great protection with the one dose with the Moderna and the Pfizer. They were not designed to be one dose vaccines. So to get the best protection possible, you need both. Johnson & Johnson was designed to be a one dose vaccine. So you're going to get pretty good protection with that one. So don't throw your mask out yet. Even after you're fully vaccinated, there's some things that you're going to be able to do, like go outside without a mask, or, with getting together with other people who are vaccinated. But even after you get vaccinated, you're going to have to wear your mask in certain situations. You're still going to have to stay apart. You still need to wash your hands. I'm hoping everybody sticks with that for a while, and stay home when you're sick. Some of these things just need to stay around, even after COVID is controlled. How long do vaccines last? At least 9 months. We're learning as we go. But so at this point, boosters have not been recommended, even though we anticipate that likely in the future we'll need some. So what are some other resources that you can share with your clients? Our Monroe County hotline can be used to schedule the COVID-19 vaccine. 211 can be used locally. It can be used throughout our region as well. And I think, as you all probably already know, they can help connect with other things like, food, or, issues with your transportation or housing. So 211 is a good thing to know. So, make sure that when you are vaccinated, to let everybody know, tell your friends, do selfies or put it, post it socially. So that, I don't know how long I took, but I'm hoping it was a little less than 20 minutes. And sorry for speaking so super quickly, but I'm happy to answer questions later.
Thank you, Dr. Clark. You were just at 20 minutes. Thank you. So now we're going to have Holly and Luz talk a little bit about the insights on the vaccine hesitancy project.
Sure. Let me share. One moment.
Can you share?
No, it's not letting me.
Hold on.
Mine is grayed out. I don't know, maybe somebody took my hosting. Try it now, Holly.
Okay. Let me see. I'm going to pull up something else and then let me see. This is not what I want to share, but there we go. Can you see a PowerPoint now?
Yes.
Perfect. Okay. So just, and I'll go through this quickly. Common Ground
Actually, Holly, we're looking at a data tracker.
Yeah, I was going to say that doesn't.
I don't know why it's not letting me share this. One moment. How about now?
Maybe mine's warming. Yes.
Are you seeing a PowerPoint slide?
Yes.
Perfect. Okay. We will go through this fairly quickly, but as many of you know, and as many of you have already seen elements of this, Common Ground embarked on a process of conducting interviews with many populations in the Finger Lakes area who are underserved or marginalized historically. So really wanting to hear people's thoughts and concerns on vaccine, anything on their thoughts on vaccine, whether it's access related, hesitancy, concerns, throughout the Finger Lakes region. So we embarked on this process in February, and so much has changed since then. Apologies for my barking dog. So to date, we have conducted 255 interviews. with people throughout the Finger Lakes. This slide, the numbers add up to more than 255 because people can be Latino, for instance, and also in rural areas and also older adults. So this adds up to more than that. To date, these are the populations we've spoken to by race and ethnicity. As you notice, Asian American, Native American, and Pacific Islander, we have not talked to those groups yet. That doesn't mean it's not going to happen. I'm happy to see Catholic Charities here. We'll actually be dropping into your staff meeting on Friday to talk about, next steps with this process and really making sure that we're engaging immigrants, refugees. We're already working with the Native Americans as well. Those are just connections we didn't have established, as strongly established when we began this process. So that's why there's the delay on that. Really just by gender, by age, we have good representation. And really, what we're beginning to see is, and I can't state this enough, in terms of communicating and recruiting people to get the vaccine and communicating information, primary care providers, doctors, OBs have come up time and time again, far more than we ever anticipated. These individuals are trusted sources because A, they're knowledgeable about the vaccine, about COVID-19, but then also they know the individual, they know the patient's health history, they have that personal connection. So really, OBs, doctors, primary care providers are really vital in this effort in terms of communicating and messaging patients. In rural areas, we saw pharmacists come up quite a bit as well. This also came up in Monroe County, but really not quite to the extent. But pharmacists are also could be leveraged in these efforts. In rural areas and Monroe County, we both saw that pastors and the faith community, again, are really could be vital to these efforts in terms of messaging. A lot of people said that they needed to speak with their pastor, that they wanted the support of their faith community in making this decision. Knowledgeable family members came up as well. And Luz, please jump in as needed. I'm going to go through this quickly though. But some of what we're hearing is, some of these happen to both be from the Latinx community, but I would love to have the vaccine done at my doctor's office. I know everyone and they know the proper way to take care of me. So many people said their PCP's office or their OB's office was the only place that they would receive a vaccine or feel comfortable receiving a vaccine. And then the lower one, in the Hispanic community, so much is on trusted sources, people restaurant owners, church people are really relying on hearing about it from people they know. So really the importance of leveraging networks and personal connections to have these conversations about the vaccine. In terms of settings, we already said this in terms of messaging and recruiting, but doctors' offices, churches, pharmacies, community centers. The one thing we saw different in the rural counties was fire departments came up as a trusted source quite a bit, as did local health departments. So in terms of Monroe County really ensuring, now that the vaccine is so much more widely available than it was in the beginning, some of these, these concerns are beginning to work themselves out with being close to public transit, being easily walkable, just having it closer to my home. We're seeing much more availability now and that beginning to take place. This quote just it breaks my heart, but it speaks to the true hesitancy and concerns that are out there. So if I had to get it, it would be in Louisville, Kentucky, with my nurse practitioner sister in her facility, in her environment. Even though that's a far distance, I would travel to get it from someone I trust and and feel safe with only, nobody else. So again, really speaking to the fact that this is not a light decision. This is not a decision that people are just taking lightly, but it's really weighing on them and realizing that that element of trust is so essential in getting vaccines into the arms of residents in the Finger Lakes. So other on-site considerations, really, it's vital to have clinicians that look like the populations they are being served. So clinicians of color, administering vaccines whenever possible, and also communicating about vaccines. This notion of accompaniment, so welcoming a family member or a friend to physically walk someone through the process of getting vaccinated, having that social support there is really vital, and encouraging that social support. Recruiting volunteers to staff the site and greet people upon arrival from the actual community. So having those faces that you know and trust is important with some communities, not with all, but and then allowing adequate time for questioning. So many, you know, have said that they don't want to feel rushed through this process. They want to make sure that their questions are being answered, that they, you know, have time to get those questions answered. And then again, many did express the importance of faith in making this decision, and needing to pray over it, and wanting that support from the faith community. So, you know, potentially it's having prayer space available at certain sites, if that's appropriate. In terms of the rural counties, a lot of this was similar, with the exception of really wanting discrete vaccination options. So again, that's where we can get to the PCP's office. You could be going to your doctor's office for any reason. But then again, if you're, you know, going to the Dome, it's very obvious that you are there for a COVID-19 vaccine. You know, you are not there for any other reason. So wanting those more discrete vaccination options is important, especially in the rural areas. So again, the Jordan Health Center staff was so warm, gentle, and caring. One of the nurses recognized me from the drugstore. I feel comfortable with all of the staff there due to their friendliness and treatment. The lady from the church worked so hard to get me in because I didn't have an email, but they kept me well informed. Churches are important in this work and sharing the news and connecting people, especially for the elderly. So this is getting at many of those elements, really making it a person-centered experience, a person-centered approach. So again, these are just kind of some of our preliminary insights. I didn't touch on this, but language access is really vital throughout the entire process. Also making sure that we have information about the vaccine that is at an age-appropriate level, not just in Spanish, but in multiple languages. Not everybody wants to hear about the vaccine. Many want to read about it and digest it at their own pace, on their own terms. So really making sure that that information is available is critical. And really just changing, you know, these large vaccination sites have really been top down. You know, how can we make distribution more person-centered and a better experience for the communities we're trying to reach? We are doing more in terms of kind of actually looking at the hesitancies themselves, and we hope to have some of that information coming out next week. It's just not available just yet. So Luz, if you have anything to add, I was not following the chat, so apologies, I can catch up on that now.
You know, I think there was one question about engaging the Orthodox communities into this discussion, because there were several anti-vaxxers there as well. So, and I think
We were
Dr. Clark had started. Yeah,
Lucy, excuse me, we were gonna hold questions until the end, if that's
gotcha.
okay?
Sure.
Thank you. Holly, Luz, did you have anything to add? No?
No, nothing to add other than we can take the questions at the end.
Okay, thank you both. And now we're gonna have Dr. Lucas talk a little bit about what that numbers matter. So, Dr. Lucas?
All right, hi everybody. I'm gonna start off by apologizing for being off camera. It just doesn't work as well in the location that I'm in right now. Stop laughing at me, Dr. Clark. So Candace Lucas, I'm the Chief Community Engagement Officer at Monroe County. And I have been leading the county's efforts to ensure we have equitable distribution of both COVID-19 testing as well as vaccination. There's been a small group of us working together since probably January or so to make sure that we're getting vaccines into the arms of our most disadvantaged, I'd say, communities, those who have the least access, and needed more assistance with navigating and so forth. So really glad to see so many of you on the call today, helping to expand our reach into these communities. We have been doing equity pods, or you may have heard it termed pop-up pods, at churches, at apartment complexes, various places where there are populations of individuals who are saying, hey, we have a group of people, can you do vaccines here? And we've been more than happy to get our clinical providers together, our community-based organizations, faith-based organizations, the county, the city, Common Ground Health, so forth, together to be able to do that. Over the last 4 weeks, we stood up what we've been calling our neighborhood pods or quad pods in each of the quadrants in the city of Rochester to make sure that access was easy, that there were familiar faces, and that people could get vaccinated in comfortable environments that they knew. So what I'll just share with you now a little bit is some of the data that we gathered from that experience. So right now, you've gotten the information for the Finger Lakes Vaccine Hub. If you were to log on to that, you would see the data for how many people have been vaccinated across the Finger Lakes region. So right now we're looking at about 54.6% of the Finger Lakes region has gotten at least one dose of vaccine, and about 40.9% of individuals in the Finger Lakes region have been fully vaccinated with 2 doses if they were using Pfizer or Moderna. If you look at Monroe County specifically, about 38% of our population has been fully vaccinated to date. Now, what we also wanted to look at was how are we doing in our neighborhood pods. The specific reason for setting up those neighborhood pods were to reach Black and Brown populations in the city of Rochester in some of our most underserved zip codes. Many of you may have heard of those zip codes known as the Crescent for many years, but those are the people that we wanted to reach. We set up pods at churches. So we used Baber AME Church, which is in the southeast quadrant, Greater Harvest Church, which is in the northwest, Memorial AME Zion Church, which is in the southwest. And we also used some of our neighborhood art centers like Edgerton, the Stardust Ballroom at Edgerton, the Jackson Art Center on Clinton, and the Ryan Center on Webster Avenue, as well as Ibero for one of our community-based organizations. What we've seen so far is that we've been able to reach of those individuals who came to get vaccinated at those pods, 32% were Black, 42% were white. We got 18% of those individuals were identifying themselves as Hispanic, 52% identified as male. And our major zip codes that we were able to reach, 14609, 14621, and 14607. We were able to get over 10% of the individuals that were attending those pods were from those zip codes. 14621 and 14609, of course, were 2 of our target zip codes. 14605 has been a zip code that has been called out as having the lowest penetration. 5% of the individuals that came to the quad pods were from 14605. And the Ibero site that we used was directly in that zip code for that reason, to try to reach those individuals. So as you know, you're learning about some of the language and the education to be used as we continue to do our grassroots efforts. These are places that we are targeting specifically. Another thing that we looked at was how many people actually came back for their second dose. So nationally, we're seeing that about 7% of individuals who get their first dose are not getting their second dose. Monroe County, we're at 3%. So we're doing much better than the national average. Only 3% of the individuals in Monroe County are not getting that second dose. But then we took it a little bit deeper to see what about Black and Brown communities in the city of Rochester. And what we noticed there is that only 2.4% of those individuals did not get their second dose. And while we don't know the exact reason for that, we are taking credit for the fact that the way we are recruiting individuals are using that relationship model that Holly just talked so much about, that the individuals who are recruiting and reaching out and providing the vaccines are trusted individuals, that we're doing it in places that are comfortable, that are easily accessible, and that are known to our populations, and that when someone isn't able to come back for their second dose, they are able to be navigated to where they can get that second dose, because we're doing follow-up with each individual. We're finding out exactly what the burden or the barriers were to them getting that second dose, and we're navigating them into a facility where they can get it. So we are seeing with the Black and Brown population, there's only 2.4% of individuals who have not gotten that second dose compared to the national rate of 7% or the overall Monroe County rate of 3%. So the work that we are doing is so critical, so important to making sure that our communities get these vaccines and that they fully get vaccinated so that we can get back to some semblance of normalcy. So I know we're running short on time. I will stop there, but if there are any questions about any of the data, happy to answer them in the chat box or afterwards. Thank you.
Candace, are you prepared to talk about, I know this is not your area exactly, the new, and Terry might be on the phone still, the data website on the flvaccinehub.org?
From, you mean like from what we talked about this morning a little bit on
A little
the earlier
bit,
call?
yeah, what's already available on the hub.
Yes, absolutely. So that's what I started off with. If you go to the flvaccinehub.org, you will see some of that overarching data that I just mentioned based on the Finger Lakes region. So you'll see where we are as an entire region. And then you'll see Monroe County, where 58% of Monroe County has at least their first dose. Some of that deeper information that I shared, you cannot easily access right now on that hub. But if there was more information that you needed, we could get that for you directly, but it's not available on the hub to that level of detail at this time.
Thank you,
Thank
Dr.
you.
Thank you, Dr. Lucas. And now we're going to have Amy, our communications person, talk a little bit about some of the tools that we have available.
You think I would
I
get this
like
mute thing
this.
down by now? Can you all see
I
my
like
screen?
this one. I like
Yeah,
this
this is the new slide. So we've gotten the people who said, sign me up, I'm ready for this vaccine. So now we're transitioning into the nook and cranny work. We're trying to find pockets of people who, for lots of reasons, either they might be a little bit hesitant about the vaccine, or they might lack access, they might lack transportation, or some reason like that, or they might lack information. And we're trying to find what barriers are keeping them from getting what they need to know about the vaccine. So our communications work is transitioning into addressing these nooks and crannies. And I want to walk you through some resources that you can access that are available. We've been talking a lot about the hub website. I just grabbed this screenshot today because there's a communications toolkit on here. If you click on that, and also the regional data off to the right here, that's where you would find what we were just talking about. For the communications toolkit, if you click on that, it will take you to a page, and I only took the first part of the page. There's lots of different items here. There's different videos, resources, things that would help you to communicate to specific populations and also general populations as well. We have things in English, Spanish, we have some other languages as well. And we just want you to know that if you're looking for resources, you can come here. You can also come to us, and we have printed out infographics on vaccines that we'd be happy to get you copies of. We also have social media posts put together. We're happy to share those. And let me talk a little bit about our social media campaign. We've created a brand called Get the Facts FLX. Now, we realize that that might not speak as much to people in Monroe County, but our thought with Get the Facts FLX is these are accounts that have the information already written in posts, and it's easy to share them. So we're hoping that organizations will follow these and share the resources out. We're on Facebook and we're on Twitter, and I believe we're on Instagram as well. And you can't share from Instagram, but we can send you, we're working on getting an email out with Instagram resources for people. And when things change, and they literally change every single day, we want to get the updated information out to people. So this is a way that we can do it quickly. For example, we drafted new messaging around Johnson and Johnson, and I'm sure we'll be drafting new messaging around Pfizer vaccines and 12 to 15-year-olds if that winds up being authorized. We also, you may have seen them on TV. We just started some 15-second PSAs. They're on TV. They're also on radio. They're in English and Spanish, and we added ASL to them. And we have put those resources on the Get the Facts FLX accounts. And many of them feature Norma Holland. We also have Scott Hetzko doing some of them. So it's a way to get a short message out there to people that the vaccines are here, they're safe, and they're free. Those are some concerns people had, and we want them to know that that is available. Also, we have a speakers bureau. If you go to our website, you can find, and you heard a mini speaker presentation from Dr. Clark, who did such a great job with it. If you want to bring a presentation like that to your organization, you can go to commongroundhealth.org and /speakers, and we'll put that in the chat. And here on that page, you can request a speaker, or you can sign up to be a volunteer speaker. And I'll show, this is just the form. There's a form to request a speaker and a form to be a volunteer speaker. And just in general, we know that this vaccine conversation, these are difficult conversations. What we want to stress is that this is a dialogue. It's not a debate. You're going to go down the rabbit hole with somebody who's seen on the internet something if you try to debate them. It's really, you want to hear from people, what's the information that they need to know, what are their concerns. For a lot of people, it's lack of information, and this is where we're really focusing on. Some people are concerned about safety, some people are concerned about side effects and the speed of the clinical trial. And as you heard today, the vaccine presentation that Dr. Clark gave really spoke to a lot of that. We want to just share a few things. If someone said, instead of saying like the vaccine is developed quickly, we say the vaccine is safe and effective. Instead of talking about Operation Warp Speed, which again is that whole quickly thing, it's FDA authorized. There was clinical testing. Instead of saying keep your country safe, keep your loved ones safe. And instead of talking about the government and vaccines, talk about public health. These are messages that have been tested as being more effective for people. Instead of focusing on that people are hesitant or skeptical, these are people who have questions. There are some messages that backfire. If you talk about fear, it can put people in a hopeless frame of mind. And if you use some guilt twinged messages, people don't want to see them, they don't see themselves as free riders, but they do want to avoid being guinea pigs. I'll just share a quick thing that happened last week. We had a forum for Indigenous people, and one of the people in the forum shared that she, because of her background, her tradition, she does not do anything that would alter her body. So for her, she doesn't get any immunizations. And so the vaccine is off the table for her. But she really stressed that she has a responsibility, because she makes that choice not to vaccinate, that she needs to be physically distant from people, and she needs to wear a mask, and she needs to be very careful about who she welcomes into her home to make sure that she's not spreading COVID to her elders. So we want to make sure people have the information and the questions they can to answer their questions, so that they have what they need to know to move from being vaccine hesitant to being vaccine confident. And please reach out if you have any questions for us or if you need materials. Thank you so much. And thank you for sitting through this and listening. COVID is preventable, and we are the key to helping prevent it.
Yes, thank you, Amy, and thank you to everyone else who spoke this afternoon. I know we went through this at warp speed, and we apologize for this, but hopefully, if you have, we're gonna try it because we've only got a minute left. So if folks are okay with us answering the few questions that are in the chat, we'll stay on for a few minutes and see if we can get those questions answered for folks. I know there was one that Holly and Luce were gonna answer. About how to best approach the Orthodox Christian communities. Holly, did you want to respond to that?
What was the question exactly? I'm trying to find it in the chat.
So it said, we would love to hear your thoughts and ideas about how best to approach the Orthodox Christian communities.
And that's something that's, in all honesty, worth a conversation. Luz, if you have anything, please weigh in. But we have reached out, we've reached out to many faith communities, but we haven't necessarily gotten to the specifics of Orthodox or not. So, I would be interested in learning more just to assess if there are any particular concerns or particular barriers. But what we've found, generally speaking, pastors, reverends, faith leaders tend to be trusted sources and can definitely be helpful in communicating some of the messaging around vaccines. If not, some of them, have physically offered up their spaces to administer vaccines as well. So there's a lot of potential there, but that's specifically, I think it's worth a conversation and exploring that a little further.
Some of the other questions in the chat had actually been answered by some of you, so thank you for that. Are there any other questions that folks may have? I see Keaton put one in there. Is the vaccine effective for those with HIV? Dr. Clark, I think that's a question for you.
I did answer that in the chat,
Okay.
and
Okay.
yeah, the answer is yes. And there's no reason to think that the immune system would not adequately respond to the vaccine, especially if you're doing everything you need to do to manage HIV.
Thank you. And then there's one, how to address the misconceptions with the refugee population.
Yeah, and we're just starting our interviews with those from refugee communities and really trying to get a broad scope of who we're talking to, which country of origin, as many ethnicities as we can. So that's something we'll be learning, definitely be learning more about. So I don't have a great answer for that just yet.
And I know that the Refugees Helping Refugees organization is one of our community partners. And so maybe someone that, Ms. Omar, you can perhaps reach out to.
Can I unmute myself? Can I speak for a second on
You
that?
sure can, yes,
Okay.
please.
Yes, hi. I actually work with refugees myself.
Okay.
And I am a refugee myself as well. I came as a refugee and I work with the refugee population. So my thing is, I've been trying to educate the population, and it's really, really difficult to get rid of this misconception. Even yesterday, I took 2 hours through an interpreter to provide that education. They hear that fertility problems, there's so many things they hear in the community that they're hesitant to get the vaccine. And as you mentioned earlier, yes, the trust is the main thing. To have a culture broker within the community, I think it's really beneficial, that they will trust and they would do it. But the misconception, I've been trying, for for the few families and I can't get across. So I didn't know what else to do in order to help those populations.
Okay.
Really
I think-
providing
I
that
think Amy-
providing that objective information is what you can do. And not everybody's going to decide to take the vaccine, and that's okay. But just making sure that they have great access to information, I think is so thank you for doing.
Yeah, thank you.
Linda, would it be relevant or appropriate to request a Speakers Bureau event with like a local mosque or leaders in the refugee community to try to make sure that they have the right education? I know that there are some slides that address some information or myths that are specific to some of the refugee populations. I think I saw a few about like whether there's animal products in it, things like that. So do you think the Speakers Bureau is a relevant tool?
Certainly, the Speakers Bureau can always be a tool, not always the cultural brokerage that you're looking for, but if that cultural broker wants to utilize the Speakers Bureau, we're happy to help. We're always looking for more diversity within our Speakers Bureau. I forgot what number we're up to, but we got at least 90 people in there. So there's some, there may be some opportunity to match a speaker with the request, depending on what that is. Thanks, Terry.
And Omar, Amy
Thank
did
you.
put in the chat that we do have some infographics printed in the various languages, so we can get that to you as well. I also wanted to just mention that we've also been collaborating with the Baraka Muslim Center over on Jefferson Avenue. I'm not sure if you're familiar with them at all.
Yeah,
Okay.
yeah. I volunteer there as well.
Okay.
so-
Oh, okay. Okay.
And I was in
great.
the board of the Islamic Center too, so I'm all over actually.
Okay.
Trying to help. With Dari speaking, I speak their language. So the Afghan population I have reached mostly, and I have convinced them, with the information and all that. And the majority has received the vaccine, but this other population, I'm sort of struggling. I'm trying through an interpreters, and as you said, we even show them video clips as well. To be more effective, because some cannot read as well. So if you provide them with information, it'll be sitting there. So we have showed them videos, we have done PowerPoint, so ongoing education. So I think, I'm not sure if there's anything else, but in the community, I think education would be the key to get into those communities, I believe.
And I don't know if you saw Dr. Clark put in the chat that you would be great on our Speakers Bureau.
Oh, sure. Thank you.
Yes, agreed. And I was just connecting with some from Refugees Helping Refugees as well. And, talking about the need to talk with the elders and really lean on the elders in many of the communities to get their buy-in and then help them, have them help spread the word about it. But really bunch of those trusted sources, who are the local leaders in these communities that we can access and reach.
Absolutely.
So I think there was one last question in there, and I think this one may be for you, Amy. Dr. Clark was asking what a free rider was.
That is, that's a good question. I didn't make that slide, and I will have to go back and edit it.
I just wasn't familiar with that vernacular. Is it freeloader?
I think it's equivalent of a freeloader.
Okay, that I've heard of.
Yeah, I've heard of a free ride too. And so I took it as that was what it was. But
Okay.
good
Okay,
question.
are there any more questions for any of our presenters? Okay, well, thank you again. We really wanted to have this forum today to let you know the tools that are available to all of your organizations, who we are as community partners, and whatever we can do to support all of you in this vaccine COVID world. We are here to support you all on that, and please reach out if you have any questions or need references or resources. Please reach out to us And we will do our best to help you with those things. So thank you very much. Thank you to all the presenters and everyone that showed up today.
Thank you for organizing this, Jackie.
Thank you. Thank you. Everyone have a good evening.